Hello friends, welcome to another episode of Aware and Care with me Madhvi Batula and Dr. Ambika Nair, who's a co-founder and chief consultant at Shantigram Group of Companies. Every week we bring a topic and a subject and a concern point where Dr. Nair helps us to understand how these particular health conditions are treatable, curable or preventable. Today we're going to talk about a very widely discussed topic and concern for women specifically from the childbearing age or from the first period when it starts. It's called PCOS. We'll discuss with Dr. Nair as to what this problem is and how it can be prevented, cured, and what are the alternate solutions for it. But for that, first we need to welcome her to the show. Namaskaram, Doctor. Welcome to Aware and Care.
Namaskaram. How are you?
All very good, Dr. Nair. I just gave you the headline that today we're going to discuss about a very common problem, PCOS.
Very good topic.
Yes. The maximum messages that we got from our viewers over the last many weeks have been about PCOS, from the age of 14, 10 to women who are 40 plus too. There are women who are nearing menopause still have these questions as to what PCOS is and why it has affected their life. And let's start with the basic about the women's anatomy and body and its functions and understand whether this is a physical condition or a hormone related condition, or it's just the structure of the body that creates this problem.
Actually, polycystic ovary, like it's a disease actually, and it is a syndrome also. Syndrome means, multiple things will happen along with that. So the people ask, like PCOD and PCOS. PCOD means only they will have little bit of, like it is same only, but little difference will be there, like obesity will not be there sometimes, like a dysfunctional uterine bleeding. Some people they start the periods, it will not stop.
Okay. So
like 3 months, 4 months, 5 months, they, and they will be on hormonal, pills and all. So these are like PCOS only.
Oh, 4 months continuation is basically PCOS and not PCOD.
No, yeah, it's not sometimes it can be, but PCOS is more actually.
Okay, so today we're going to discuss exclusively about PCOS.
PCOS. Yeah. Because it's a syndrome.
Questions about this particular condition, of course, this program is for you. But if you also want to know about PCOD, we will try to cover that in the following weeks. So, Dr. Nair, let's start with the basic about PCOS. When does a female body realize that she has PCOS? How is it diagnosed?
See, like some children, like when they are getting the periods, so they bleeding does not stop. So much of acne. You can see their face and all, they will go with antibiotics and everything like that. Mild obesity. We tell that, like a pear shape they become. Okay, and like irregular menses. Sometimes, like it comes like once in 3 months, once in 4 months. Whether it bleeds or whether it doesn't bleed, like continuous bleeding. But, some people it will get like that only. And, you can see the hair growth on the, that is because of the most, like a male hormone, like androgen. It produces a lot.
Okay.
So that's why, that we can see that hirsutism, so much of hair growth. That's also like male people, it will be like that. So, and, they will have even something like baldness also, like male pattern baldness. So like this, we will be able to.
Somebody, a young girl is having PCOS but is not having acne and is not gaining weight and is not having that male pattern of baldness, but there is still irregular periods. It could also be, does it always have to be obesity related or it has to?
No. Everybody will not be, but PCOS definitely obesity will be there.
Obesity will be there. Okay.
Yeah.
And so this is a hormonal condition. Or is
this
something?
Is a real, it is like only characterized with the hormones actually. It can be genetic also. Mother may be having this problem. Mother may be having thyroid, not taken proper medication. Then gave, like IVF or anything like that. They gave like a childbirth. So such children also, we have seen that even genetic also can affect like that.
Okay. Now, so young ladies who have PCOS in the technical terminology, and once again, friends, this is only an information-based program. To understand the detail of your condition, you have to have a checkup and an appointment with your doctor or gynecologist or with Dr. Ambika Nair. So this is basically only an information-based program that we need to take it to the next level. So when somebody is diagnosed with a PCOS, Dr. Nair, when the periods come after a long gap, let's say after 3 months or 4 months, is it painful or it is regular or it's very, very heavy?
Some days it will be painful. Dysmenorrhea can be there. Some days there will not be any pain, but like a continuous flow will be there. Clots will be there. Some days it will be very painful. So it all depends upon the person also.
Okay. And somebody who has PCOS, as you just mentioned, that the causes for it is hormones, but is there also a possibility there's an underlying condition like diabetes or thyroid? That's the reason they
No, if you don't take care, see, like obesity, I mentioned first itself. Obesity means that you can see that in they are prone for like diabetes, type 2 diabetes, and they will have like they will be like see, if you go for the ultrasound, how will you diagnose? That's more important. The blood levels here. Blood levels also, they will see that FSH, we have to see that all the hormone levels, even thyroid, ultrasound also, whether how the ovaries are there, whether it is with so many, cluster of ovaries will be there. So that's why polycystic, small, like a small nodule type will be there. So it camouflages. That's why the ovary cannot function in the proper way. Let's say people will tell that because she cannot conceive. Some people will have like irregular periods, but the bleeding will not be proper. So that is also one of the reasons.
Dr. Nair, you just mentioned there's a cluster of ovaries, but there are only 2 ovaries. So
no. Like small nodules will be there. Ovaries on the top of that, because that's why polycystic we call it as. So many, like nodules type, like it will be there. So like a pail, it will be like a string of pails. It will be showing.
So how serious is PCOS? I mean, of course,
PCOS is really serious. Actually, if you don't take care, you can become diabetic. You can, like your liver, fatty liver can happen. Like sleep apnea can be there. Blood pressure can go high. And even your cholesterol level, when the liver is not in the proper way, like all your hormones also, and your, like a good cholesterol can be down, bad cholesterol can go up. So many things are there. Then blood pressure, depression, fear, you lack your confidence. They don't like to come out. Some people, they don't like to meet people, when you have such things, because they are not like that. They cannot accept what they are undergoing. We have seen a lot of cases like that actually.
Wow, I never expected this part of the information to come out, that somebody with PCOS, the liver also get affected.
Yes.
So
and you can see the skin also, when you observe, like, see, you can see that the discolored, skin on the neck area or the axilla, and even under the breast, under all those things, so much of discolorization will be there. So this all shows that, like how the insulin, whether it is working or not.
So Dr. Nair, we're just starting to discuss about PCOS and the effects it can do on the body, apart from obesity, to other underlying health conditions that it can affect. Now, can PCOS go away? Because I've also heard stories, or is it a myth, that even during menopause, some women still have this problem of PCOS. Is it true, or is it some underlying?
Actually, it is, like you see, very much diet control, exercise, and there are very proper treatment for that. With that, you can manage it very well. But without the patient's, like consent, like see, whatever the doctor says, because both has to work together. Then only how much they help, we will be able to help them more. Because diet is more important in what they should eat, what they should not eat, why are they suffering like this. Later, you can see some days, like they get into thyroid also.
So, doctor, I've heard about saying that there are types of PCOS, insulin resistant, or inflammatory, or hidden, or pill induced. What are the differences in that?
Actually, see, like you can see even from the skin, like a thickened, like a very thickened layer that is high insulin resistant actually. Thickened, like the skin will become very dark, even in the axilla. Very different look it will be under the breast, all other places, like all the like groins and all. Yeah, not whole body, in certain areas.
Certain is body, okay.
Yeah.
And then what about hidden PCOS? What does that mean?
Hidden be, like because they will not be like, some people will be very regular. See, nowadays everybody has a lot of stress. You understand? So, like so much of stress, they are not sleeping properly, some death in the family, or some divorce, losing the children, losing the parents, losing the job, and like their positions in the office. So all these stress factors also really contribute a lot for this.
Okay. Now, what about fertility? Is pregnancy, getting pregnant, a big problem for women who have PCOS?
PCOS, it's very difficult because their endometrium will not be proper actually. Yeah. So, like, but we are doing a lot of cases. I have a lot of cases what I have done in PCOS. They have conceived, they have like 2 children, 3 children and all.
Wonderful. Okay.
Since long, it's throughout my journey, I have helped so many people like this.
Now, what is an appropriate time or age for somebody to recognize this problem and come for treatment? Because if you notice, periods by itself for women is a very, very messy situation, and people are very uncomfortable about it. Young girls today are happy that they don't get periods. And if you know that it is PCOS, what time do you think, or phase do you think that they should intervene for medical, attention?
Madhavi, actually now children are more aware. They have an app also. So they, like children when they come to me with their parents, so they tell the date when they got it, why are they having like this, like. So they are very, like not like in my time or even your time, I should say. So they are more aware. They know that they should get every month, how many days they should bleed, whether they should have clots, whether they bleed more. Some, like because so much of pain and all, they come really. They won't wait like before. They don't feel shy to come.
That's wonderful. Okay.
Very nicely, they are taking care, I should say.
So what about women who are on birth control? Does the treatment of PCOS get affected because of birth control pills?
See, we get a lot of cases like that. They will be on, like birth control pills for a long time, like 3 years, 5 years, 10 years and all. So when they, like, so now people are aware of the natural remedies. So all the complications, whatever they had, they don't want to continue with that. That's why they come to our clinic.
Okay.
So they are, like, so what he can do, they will be asking us like that. So it's very interesting also because they are tired of taking all these pills.
Okay. So Dr. Nair, what can you do when somebody is coming with PCOS to you? What is the steps of the treatment? And
it's a big line of treatment. First of all, we have to see whether what is their constitution. 90% it will be like a kapha constitution and vata, very restless people. They don't sleep in proper time. Some people, they travel a lot, so they take a lot of other medications also.
Wow, okay.
And, like if you don't take care of PCOS for a long time, then, all the metabolic disorders will come to them. So it become a metabolic syndrome. If you don't take care of that, then we ask, whether, like history is also more important, is how often they get their periods, how long they bleed, whether, like after 15 days, some people will get like that.
Okay.
After 15 days, whether they are getting the like absence of period for a long time. Madhavi, some people will have like once in a year periods.
Okay.
1.5 years back, I got the periods. Recently, I have a case like that.
Wow. So that's not normal.
So, yeah, like 19 months back, she had, because she was always on birth control pills. Now she doesn't want to take. Even she was telling with the birth control pills, she was not having that good effect. Maybe she was not taking it properly. We don't know that. Okay. But all the complications were there with her. So like I told her, like what is your diet, what time you go to sleep,
Mhm.
whether you are able to focus,
Mm.
whether, like small things worry them or not, any moving pain in the body, any constipation,
Mhm.
any dizziness, whether they are able to focus properly, remember properly, retain their memory properly. Okay, whether getting into depression, impatience, so
Dr. Nair,
much of, like irritability, all those things, we have to see. It's very interesting actually case, actually, today's topic, what you asked me.
so Dr. Nair, now you just mentioned about this particular case study. We wish her the best. But 18 months, she's not got the periods. She was on birth control pills. Now she has stopped taking the birth control pills.
Yeah.
The periods are not started.
No, we started the medication. I know within
Okay.
2 weeks she will start it.
Fine. Okay. So now let's go to the treatment about how this is being handled. So you get a case study of the person, understanding whether it's hereditary, what are the maternal side concerns, or Atya side's concerns and the body thing. And you've done the blood test also. So what is the course of treatment?
They will come with all the blood work only. So all the reports will be there, like, full reports will be there. Either they will show on the, like the report will be there or on the phone.
Okay.
So we go through that actually. We go through the reports also.
Okay.
Then, like what I told to that person is that I gave her the medications, I gave her the diet.
Okay.
All the cruciferous vegetables I have stopped her.
Okay.
We have cut down all her, like carbs. And no aerated water.
Mm-hmm.
Especially in this time, because people go for like so much of, younger generation, they eat a lot of sugar,
Okay.
chocolates, all those things, so we told her not to touch the sugar at all.
Oh, wow. Okay.
Okay, that because she doesn't need it actually.
Mm-hmm.
She was on like so many other medications also from the allopathy side.
Okay.
Okay, cholesterol was high, everything was high. So, like she had constipation. So we have given her the Abhibatikar so that she will have a good bowel movements.
Mm-hmm.
So much of gas formation was there. And there was swelling even on her feet.
Wow, all these are conditions.
And, like a whole body, actually I should say that, because the ring, we ask the person, whether they won't understand it actually. So we'll ask whether when you get up in the morning, can you fold the fist or your ring become tight? So she was saying, oh my God, you have, like, so stiffness in the joints.
Mm-hmm.
So we can get into all this, like, so then, like a line of treatment, like after giving this, then I started with the Kanchanar Gulgulu.
Uh-huh.
Okay, then, like Dhanandaram tablets. Punarnavadi, because she had a lot of like swelling in the body.
Mm-hmm.
Chandraprabha was given.
Mm-hmm.
Ashoka Rishtam was given. Tejapravartanavadi.
Okay.
Pusli Khadiradi. There are so many very good medicines. Then, we gave her Shadavari also, so that will help her a lot. Okay, and we will get the report very fast. We know that actually.
Awesome. Now,
Then,
Doctor, you've given so many options for the medications that are required for PCOS, and of course, under the guidance of the doctor, this is being done. Now, I also want to bring to you a patient who is already relying on insulin because of diabetes. Now, what happens to patients who rely on insulin and then come for PCOS treatment? Does it anyway clash, or they have to take something else?
No. With the diet itself, because they are this is a very good question actually, what you asked. Thank you for that. Okay, so, like if there are very good medications also in herbal supplements are there in Ayurveda also. So once the diet itself is established, we tell them to go for real exercise. After this, that their insulin, that injection level, it will come down a lot actually. The dose comes down.
Okay.
They monitor everything. They will tell that now we are coming. So many clients have come before also. Sorry. Okay. So, what we did, like, so their doctor, they will go back to their doctor. Their doctor has to put them on pills afterwards. So many times it happens like that.
So friends, when you're watching this episode with Aware and Care, and in the majority of the programs, and always Dr. Ambika Nair has assured you that if you're on any medication before the treatment at Shantigram starts, the treatment does not interfere with your medications. In fact, it helps you to reduce your dosage in most of the cases. So always when you come to the doctor, please bring your entire charts and information, and always feel free to ask questions like this where you have doubts about your existing medical conditions that will not interfere with the treatment at Shantigram. So Dr. Nair, let's also understand a little nice diet plan or home remedies which would help to relieve or comfort somebody who's having PCOS.
We will, like I told you, cutting the carbs.
Carbs and cruciferous vegetables.
Yeah, that is more important. Actually, deep fried food should not be taken. They can take like lime and like honey in the morning.
Lime and honey. Okay,
Yeah.
cold to hot water or just like lime and honey?
Warm water. Everything has to be warm.
Water.
Yeah.
Okay.
Triphala Gulgul is very good actually. That will help a lot. And, like so that they can reduce the weight. But in Ayurveda, we have like for the obesity, how we treat. Uddhavardhanam is done. Nasyam is given. So we do treat. Uddhavardhanam is a polishing of the body. So, it will help you to, it's done actually for prevention of obesity, arthritis and diabetes. So PCOS is always there for that.
Okay.
So that will help a lot.
In the beginning of the program, you also mentioned about some hair fall and male pattern of baldness for females who are having PCOS. Now, during the treatment, do you also see that their skin, because the skin condition improves, that means to say the hair also improves?
Drastic changes will be there.
And I know our viewers are excited to ask this question to you that, Dr. Nair, how many months do I have to take the treatment? Dr. Nair will be very nice.
No. Only 3 weeks. And the medicines, like you will continue. See, like how you deliver a baby, like 9 months you need, right? So till that time, afterwards, whatever you need, just to follow up, like so that you will not fall sick. Awesome. You will get your periods in proper time. So that will be advised to you. You can always, come for follow-up consultations. So we are there to guide you.
As a woman myself, and to all the women who are watching their PCOS, as we have understood from this program today, that it is a very uncomfortable situation, and with so many built-up conditions that follow if you are suffering from PCOS. And it is such an assuring moment where doctor said that it's just 3 weeks of strict regimen and discipline of taking medicines, and it is curable, and you can lead a happy life and more progress towards better things. Dr.
3
Nair,
weeks of Panchakarma.
Panchakarma is also very important, and that can also be done.
3 weeks of Panchakarma.
3 weeks of Panchakarma. Okay, I got myself corrected.
Later they will, that's what I told. Later they have to follow up. Yeah.
They have to follow with the thing. So, of course, diet and exercise is an integral part of all the Aware and Care programs that we have done, and where Dr. Nair has insisted that many a times you don't have to go to the doctor if you have your diet, your sleep, and your exercises on time and with discipline, and then you have a healthy body. Dr. Nair, any missing points that you want to cover about PCOS and let our viewers know today?
So they can, do Abhyangam at home. Any oil, whatever available they can do. Do the breathing exercises actually.
I am okay.
Yeah, and don't overeat. Emotional eating, that is more in PCOS. Yeah. Small things will worry them.
But Dr. Nair,
they feel hungry or not, they will eat.
Thank you, Dr. Nair, for today's episode on PCOS. And I know many women who are watching this episode must be very thankful for all the different topics that we bring. And friends, if you feel that any question was missed, you know what to do. You need to meet and consult your doctor as soon as possible and lead a happy, healthy life. Thank you once again, Dr. Nair, for your time and all the information that you provide for a healthy, safe living on Aware and Care. Thank you.
Thank you so much. So if you have PCOS, don't get upset. So Vandhyata, infertility is not that, that we can always take care.
Okay.
Be confident. Thank you so much.